Hello, and welcome to Future of Health 2022 Solution Showcase. My name is Danielle Braun-Carlin, Program Manager for the Future of Health here at Communitech, and it is my absolute pleasure to welcome you to today's extra special interactive event. Whether you're a clinician, an innovator, or healthcare administrator seeking solutions to really complex problems relating to interoperability, systems design, equity, or prevention, you've come to the right place. We have an impressive lineup today featuring healthcare and innovation leaders, not to mention brilliant founders who you'll hear pitch their genius innovations designed to overcome some of the biggest challenges in our healthcare systems today. More on that in a moment. But first, a little something on what we're doing and how we got here. This event is the outcome of more than 8 months of work from a vast community, including hundreds of leaders, innovators, experts, and pioneers from scores of organizations across Canada. Together, we've explored and defined 30 complex healthcare problems before launching a national campaign in which we asked Canadian innovators, how might you solve one or more of these problems? What happened next? Well, we received 88 top-notch start and scale companies that applied to be part of our program from coast to coast to coast. And from those submissions, we selected the best companies prepared for pilots and procurement for you all to learn about today. But before we get to that, I would like to take the opportunity to thank our title sponsor, Manulife, our lead partners, EY, Sonova, TD, and WSIB, and to our contributing partner, Wawanesa Insurance. Thank you all for supporting us in such a meaningful way throughout the program. We're also grateful to the teams at CanHealth, Ontario Bioscience Innovation Organization, and the Integrated Health and Social Services University Network for West Central Montreal for their support throughout the program, as well as many brilliant experts who volunteered their time to get us to this milestone event. A special shout out also goes to our friends at Platform Calgary who are joining us live from the Platform Innovation Center, and our friends at Conestoga College, where students, staff, faculty, and alumni are watching together on the Dune campus. Thank you all for organizing and attending these in-person events. Finally, I would like to thank you, our attendees, for joining us today. 2 hours in mid-December is certainly no small commitment. Now let's get on to our agenda. In a few short moments, you'll be hearing from Kim McFarlane, VP, Group Benefits and Digital Experiences at Manulife, followed by Dr. Mohammed Al-Arakia, a family physician, educator, and Managing Director of the eHealth Center for Excellence. Then, of course, you'll hear pitches from 5 companies in the interoperability and equity and system design categories, followed by a 5-minute break before we reconvene to hear pitches from founders on about how they might improve prevention in Canada's healthcare systems. This will conclude our pitch presentations for the day, but the fun is just beginning as we break into the networking rooms so that you can all meet the impressive founders here today, as well as your peers and others interested in healthcare innovation. This will be an exceptional opportunity to really dig in and to engage with the future of health ecosystem that we've been developing over the last 8 months. So now that you know what's going to happen over the next 2 hours, let's get on with it. As mentioned, Manulife is our title sponsor for the Future of Health, and they have provided us with invaluable support in advance to advance this program along the way. So it's my absolute pleasure to introduce our first speaker, Kim McFarlane, VP, Group Benefits and Digital Experiences at Manulife. Over to you, Kim.
Thanks, Danielle. Appreciate
Sorry, Kim, you're just on mute, I think.
Can you hear me now? Hello?
Yes, we can.
Yeah, we can hear you.
Danielle, can you hear me?
Yes, we can hear you, Kim.
Thank you. So as I was saying, what a tremendous honor it is to be here, and Manulife is very pleased to be a lead sponsor event. Future of Healthcare is something that's very near and dear to our hearts as we look to, ourselves advance and support the health and well-being of Canadians. some of you may be wondering, what does an insurance company know about the health and well-being of Canadians? Well, we do see it every day. When somebody submits a claim, we can see, where they're maybe struggling with their health. When we're working with somebody who's on disability and trying to get back to work, again, we try and provide support for them. And often what we're seeing is, individuals are striving to be healthy and live their best lives, but are often faced with some of the challenges that are and barriers that are facing our healthcare system. And so it was very exciting for us to have the opportunity to participate in the Future of Health and support the innovation that this group has brought forward. And so we're looking forward to seeing the submissions and having an opportunity to meet with some of the founders that are here today, and want to congratulate you all for your thought leadership and for your innovation. As I said, future of healthcare, or future of health, is so important, and the spectrum of solutions that you've brought forward are most impressive. So thank you for your time, and again, I'm very much looking forward to this event. Thank you.
Thank you very much, Kim, and to Manulife for your ongoing support. Now for our next speaker this morning, I'm pleased to introduce you all to Dr. Mohamed Al-Arakia. Dr. Al-Arakia is a family physician at the Center for Family Medicine, the managing director for the eHealth Center for Excellence, a assistant clinical professor at McMaster University, an adjunct professor at University of Waterloo, the faculty digital health and innovation lead at McMaster University at the Michael G. DeGroote School of Medicine on the Waterloo campus. And in addition to all of this, Dr. Al-Arakia has been an incredible supporter of the Future of Health program, offering his expertise and his time along the way. So thank you, Dr. Al-Arakia, and for all you do for our communities. Over to you.
Yeah, thanks very much for that kind introduction. I must say, I do all that stuff to keep myself out of trouble, but I'm only successful half the time. If you go to the next slide. There you go. So, I'm really privileged to be talking to you today, and I'm even more privileged to be on the front lines talking with patients about their health and wellness. And I'm hearing about all the challenges in the system, but also great ideas about how we can do things better and better from what we've been through. And so if we move to the next slide, many challenges in the health system, wait times. Everyone's familiar with challenges about wait times for surgical and diagnostic imaging tests. We also know in terms of cancer screening that we have wait times for results for cervical cancer screening, for example, and also, really long wait times for mental health and addiction services for patients. So these are areas that we need to, and we should do better for our patients. And, we need to think about different creative ways. We've all heard about overflowing emergency departments and the need to really look at how do we help patients in the right conditions. And then clinician burnout is certainly something that is driving many clinicians to retire, as well as staff. We know, for example, in 2025, 1 out of every 5 Ontarians will be without a family doctor. And we know having a relationship with a clinician leads to decreased morbidity and decreased mortality and decreased health system costs as we leverage resources in the community more effectively. And so there's a lot of problems in our healthcare system, and might sound like doom and gloom, but really we know that necessity is the mother of invention, and we know that we have bright minds here with us today and in our ecosystem to really allow us to solve some of these challenging problems, which have been there for a while, but certainly have been exacerbated by the pandemic. So there's so much hope that we can do things in a different way moving forward, but we really need to make sure that we are intentional about how we do that. And in the next few minutes, I wanted to talk about that, really about how do we move forward from where we are today, and how do we accelerate some of the benefits that we can see by leveraging some of the great technology and the great work that's happened on reimagining things like models of care. We'll move to the next slide. And so it's always challenging. I live in Waterloo, and I have about 100 med tech companies around me, and I frequently meet with them, and they say it's really challenging to get into the healthcare system. It's really challenging to take something that we've really put our hearts into, we've really developed, and to have a meaningful impact on healthcare, which is why we're doing this. And so I wanted to talk to you today about the fact that there are mechanisms to do this. There are mechanisms to accelerate innovation in our healthcare system in a safe way. And I wanted to give you an example about how we've done that. And hopefully you can leverage that as organizations and health systems to really look at how to move forward in very tangible ways in the immediate term, with leveraging some of the great things that are out there and really implementing them in a way that supports clinicians and really improves patient outcomes. And so what we've done as an organization, the eHealth Center of Excellence, on behalf of the health system, is we've run a number of innovation procurements. And this is really about saying we have a problem in a healthcare system, some of the problems that I've mentioned, and we're able to take those problems and work with a technology company to develop a solution, to make sure we iterate and get it right, and then scale and spread. And so I'll give you an example of where we've done this, and there are a number of other great examples as well. So we'll move on to the next slide. I mentioned the wait time problem. We know that patients are waiting too long for many different services, and it's something that is a complex problem. There's many different factors that are causing that. We've got an aging population. In certain areas, we don't have enough specialists. Specialists are not organized to support getting to the one with the shortest wait time. And so there's a lot of things that are sort of against us. But what we did is we put out to the market that we needed to solve the waitlist problem. We needed to make it easier for patients to get access to the services that they needed in a way that supported clinicians, that integrated with electronic medical records, that allowed tracking of real-time wait times, that gave patients full transparency through the referral process, so they could see that they were referred, that they were triaged, that they have an appointment, and they could confirm online, sort of like how they track a package. We wanted them to be able to track a referral in the same way. And so we put those requirements out to the market, and we got back a tremendous response for the market. We worked with Communitech, and we ran an innovation procurement. And so through that process, we made sure that we had founders and startups and scale-ups as part of our journey, so that we could make sure we had the best and brightest ideas to solve what some call a wicked problem in healthcare, the wait time problem. We'll move to the next slide. And through that process, we landed on a consortium with a scale-up, Cognizant MD, that was sort of founded in this area, Think Research and the Center for Effective Practice, as a group of companies that really put forward a compelling solution that they could develop with us, and not to us, that they were going to develop with us, that they were going to make sure that it met our needs, and that we could then scale and spread. And so we entered into a two-stage contract with them, first to do a proof of concept to make sure that we could develop the technology so it supported patients and clinicians. It met all of our requirements. And once that was complete and it was successful, we were able to scale and spread that. And currently, we are rapidly scaling this to serve 14 million Ontarians in our province. And I'll show you in the next few slides how successful this actually has been. But really the key is that we were able to include a very small starting company within our process, and then able to support them to scale and spread to solve a critical healthcare problem. We'll move to the next slide. And so as a result of this partnership with this innovative company, we were able to bring in clinicians and patients and made sure that we iterated the solution. We've introduced hundreds of enhancements over time leading to great satisfaction by clinicians, huge buy-in, and really great outcomes for patients. And we've been able to achieve what we wanted to achieve, a system that was nimble, that integrated with other systems, that allowed us to incorporate best practice, and was able to be scaled and spread across the province. We'll move to the next slide. And so, in a short time, we've been able to get to almost 1 million electronic referrals being sent. Actually, in the next few weeks, we will hit the 1 million mark in terms of e-referrals. We're at a clip right now of exponential growth, about 50,000 e-referrals per month. We have over 5,500 clinicians, family physicians, nurse practitioners sending referrals, over 1,700 specialty programs on the system, all with high patient satisfaction, all with high clinician buy-in, all with making sure that we close the gaps on things like incomplete referrals. We've been able to increase the completeness of referrals to 90%. That saves about 6 weeks of time. And we're seeing the benefits in terms of actual results without doing anything else other than digitizing the referral process and streamlining it. We've been able to decrease wait times by almost 2 months for hip replacement and 32 days for MRIs. So have seen tremendous benefit. And I think we're just getting started as we expand this to many different specialty areas and really leverage some of the additional capabilities that we can in the future, like leveraging artificial intelligence. So, we've been able to take a problem, work with a founder and a company to really solve that problem, and then scale and spread in a very short period of time. And so if you go to the next slide. And so what I think hopefully this demonstrates is that, we can solve the problems in the healthcare system by leveraging the talent that we have and do so in a very meaningful way. There's other examples that I can talk about, but I think we're going to see 10 great companies today that will give us enough reason to really be hopeful about our future, that we're able to really solve these critical problems. And we're going to have companies that talk about mental health and secure messaging and looking at diet and other things that really will solve our critical problems in our healthcare system. And so what I think is important is that we be bold, is that we say that we need to make sure we invest in this approach so that we can solve the classical problems that we have had in different ways, and really take that leap forward. The clinicians in our health system and the patients in our health system really depend on us being bold and moving forward in a way that's going to serve their needs well. Really appreciate the opportunity to talk to you today, and really looking forward to the presentation by the founders. Back to you, Danielle.
Okay, we are certainly all benefiting from you keeping yourself out of trouble. So thank you very much, Dr. Alarakia. So as mentioned in the opening remarks, the 30 challenges that we presented to Canada's innovation ecosystem fell under 4 themes, which were interoperability, systems design, prevention, and equity. And each of the presentations you'll hear today will fall under those areas, but many of them will actually cross into multiple categories, of course. But the first theme that we're covering today is interoperability. So fragmentation among care teams hinders communication and data sharing. And so we asked founders how they might design a unified collaborative system that improves patient outcomes. And the first founder that we have here today and first presentation of the day in the interoperability category is from Amer Eldelgawad, COO of Fluid AI. So Fluid AI's technology revolutionizes post-operative care and helps improve patient outcomes with new groundbreaking technologies. So if you'd like to learn more about Fluid AI or connect with Amer, please keep an eye on the chat, because we'll be posting a link and a code to our Mentimeter. So simply click on the link that you'll see in the chat, enter your email, and click submit. And following the event today, I'll also be providing an introduction to all of you, and we'll give you a reminder after the presentation. So with all that being said, Amer, over to you.
Thank you so much for the introduction. And I'm just pulling up the presentation now. And let's get started. Good morning, good afternoon, and good evening to everyone on the call, wherever you are. I'm Amr Abdul Jawad, the Chief Operating Officer and one of the co-founders at Fluid AI. We're on a mission to reimagine how care is delivered in the post-operative field by providing clinicians with enough data to be able to manage their patients after surgeries. One of the challenges with today's standard of care is when a surgery happens and a complication develops, we have to wait for symptoms to appear before we can begin examination and then diagnosis and finally treatment. Unfortunately, the window between when the complication develops until we get to treatment can sometimes mean the difference between life and death for some patients. And that window today is anywhere between 48 hours to 72 hours. For some patients that do end up surviving the complication, their quality of life gets impacted significantly, costs increase, and spiral out of control. So in short, it's a delayed and reactive way to handling post-operative care. Now, as you can imagine, complications are numerous. So initially, we decided to focus on general and GI surgeries, and one particular complication known as anastomotic leakage, which has been the bane of intestinal surgeries for decades. For those on the call who might not be aware of the problem, a classic example of this would be a patient coming in with a tumor that wraps around a portion of the GI tract. In order to get rid of that tumor, they would need to excise portions right before and after, and then reconnect with the staple line that you see over here. For many different reasons, however, that staple line can sometimes get compromised and content from within the GI tract would leak into the abdominal cavity. So what we have developed at Fluid AI is a pocket-sized device that augments existing drains and catheters today in order to analyze the fluid that is being extracted from within the body, in order to provide real-time feedback to clinicians to understand what the status of their patients look like. So as the fluid flows through the device itself, it goes through our sensors, which analyze specific markers that are indicative of a leak developing, and then they push out that data to our platform stream, where clinicians can visualize exactly what's happening with their patient. And through our most recent clinical studies, we've actually been capable of demonstrating that we can identify leaks 6 days ahead of the current golden standard of care, and with a high level of sensitivity and specificity. In one particular case, we were even capable of demonstrating our capabilities in terms of minimizing readmissions. With this particular patient, the patient went through surgery, was discharged on post-operative day 5, assuming no leak was developing and that no complication had happened. Unfortunately, the patient was readmitted again on post-operative day 15 with sepsis, which was due to a leak, before being discharged on post-operative day 28. Given that this was a retrospective study, we couldn't change the course of action and intervention, but our data suggested that the patient was leaking on post-operative day 1, which in an interventional type study, we would have actually changed the course of action completely and a readmission would not have been on the books. Beyond readmissions, the value that we offer to healthcare providers, to patients, extends to so many different areas, one of which is the cost savings associated with such a complication, where we have calculated that cost savings associated with leaks can go up to close to $45,000 for patients that do leak, and around $5,500 for patients that don't leak. And this is attributed to early detection of the complication, early management of the leaks, as well as discharge of patients sooner. And when you extrapolate that over the entire hospital that conducts close to 1,000 general and GI procedures per year, you're looking at close to $10 million in savings. We're very fortunate to work with some of the top institutions in the US, in Canada, as well as in Saudi Arabia, where we have been able to test this product on more than 250 patients and with more than 25 surgeons. And we've been able to get a tremendous amount of feedback on how seamlessly it can integrate with existing workflows. With this feedback and with the work that we're doing over the next couple of years in terms of commercial launch, we're focusing on initially launching in Canada by Q1 of 2023, where we're a Health Canada approved device, with most recently getting an award by Mohawk MedBuy under the Innovation RFP pathway. And in parallel, we'll be launching in the GCC by Q1 of 2023 as well, through a distributor model. So far, we've been able to raise more than $5 million in funding through a couple of different rounds, a pre-seed round that was closed back in 2018, 2019, which was complemented by a friends and family angels round of close to $500,000. That allowed us to build our device prototype, initiate our animal studies and complete them, as well as initiate our clinical studies. In the middle of COVID, we were able to raise an oversubscribed seed round of north of $2.5 million. That allowed us to obtain our Health Canada approval, as well as submit our Saudi FDA approval, complete our clinical studies, which are wrapping up by the end of this year, and establish our manufacturing line. Right now, we're in the process of closing a Series A of $8 million. We've already have 80% of that amount between committed and closed. And with that funding, we'll be initiating market access and building our sales force in order to get into the market. Today, we talked about GI and general surgeries, and particularly anastomotic leaks to begin with. However, we have future applications that we are going to be working on in the next couple of years in order to unlock more indications to improve post-operative and patient monitoring sectors overall. Thank you so much for listening. If any of what you've heard today is of interest, whether on the fundraising side or partnership side as we go commercial, I'd be more than happy to chat with you after. You can find our information below, which is a reminder that I need to hide this. And thank you so much for listening.
So much, Amar. Now here's the interactive bit. If you'd like to learn more about Fluid AI while it's fresh in your mind, scan the QR code on your screen or go to menti.com and enter the code on the right side of your screen. Type in your email address and click submit, and following the event, we will provide you with an introduction. You'll also see these details in the chat if you missed them here. Moving forward, the next presentation here is from Sigma HealthTech Inc., from their Chief Medical Advisor and co-founder, Dr. Duncan Rosario. Sigma by Sigma HealthTech is an end-to-end encrypted secure messaging platform for Canadian healthcare providers and frontline workers to conduct secure patient communication and engagement. As mentioned before, keep an eye on the chat because we'll be posting a link and a code to Mentimeter so that you can learn more about Sigma HealthTech and so that you can connect with Dr. Rosario. Now, Dr. Rosario, over to you.
Thank you very much. Can you see my first slide, Danielle?
Yes.
Perfect. Good morning. I'm Duncan Rosario. I'm the Chief of Surgery in Oakville, a general surgeon for over 25 years. And I'd like to talk about a fundamental issue in healthcare, which is communication, or actually my failure to communicate and put patients in the center of their care. I have seen the challenges that medical offices have communicating with other offices, with providers and patients. The pandemic has demonstrated the fundamental need for multiple safe channels of communication. 20% of faxes fail. Our patients can't reach us on the office phone. Large amounts of personal health information is moving without encryption through conventional email. Several years ago, I met the CEO of the Sigma Group, one of the large software companies in Canada, and I was describing the problems in Canadian healthcare. And so we created a team, and with blue sky thinking, envisioned an ideal communication platform of the future for today. Healthcare fundamentally has a data problem. We can't communicate personal health information between offices, providers, and patients to provide compassionate, team-based, omni-channel care. Email is just not secure. Patients want to see the providers they know and trust for continuity of care, but they need multiple secure channels of communication. The tools we have are piecemeal, they create data silos, and they're often non-compliant with privacy standards, and they're onerous to use. The solution that we have created is called Sigmail, which is fundamentally team-based, integrated, secure messaging, e-consults, and video for healthcare, with a very easy-to-use email-like interface with an instant messaging backend. It's deployed in the cloud in Canada as a SaaS product, office-to-office messaging for referrals, consults, and patient management questions, and provider-to-provider communication for collaboration on patient care with e-consults, and office and provider to patient communication in one integrated system that creates a virtual front desk for effective and compassionate team-based care. Team-based care refers to our unique workflow where we stratify messages into a shared inbox for patient messages and a personal inbox for others. The average provider, when asked if they could exchange 40 messages a day with their patients, would say they simply don't have the capacity to do that. But knowing that asynchronous messaging is 5 times more efficient than synchronous methods of communication like phone calls, spreading the care across your entire care team can boost office efficiency up to 12%. And using secure messaging in healthcare results in more efficiency, productivity, greater compassion, and less burnout in care providers, being able to do more with less time and increase physician revenue. Our solution is certified by Canada Health Infoway and Ontario Health. It has been proactively audited by the Compliancy Group and found to be fully HIPAA and CASL compliant. And to reduce data silos, we integrate personal health information by pushing data directly into all Ontario EMRs. We have direct integration with the OSCAR EMR and Accuro, and we are using Ontario MD's HRM system for all others. This is fundamentally how you axe the facts. And we have introduced in the past 6 months automated billing with e-consults and telephone consults so that virtual care done on the platform by physicians is billed automatically to OHIP by Sigmail. We pay physicians to use the platform with no subscription fee. This de-risks the implementation of our platform. We become an operating profit center instead of a capital expense. And what has the competition done? The same old types of platforms with unidimensional systems that connect only 2 parties and place the whole challenge of care on providers, not on their teams with little or no integration into EMRs. The Ontario Medical Association has made digital connection a key part of their platform. We can be the digital tool. Fundamentally, we're a SaaS product that's available for virtual care. We pay physicians to be on the platform. By our estimates, we can increase office efficiency up to 12%, which for the average physician is over $40,000. And once secure messaging with patients is billable in Ontario, likely in Q1 2023, the system will create an additional revenue boost for practices. Overall, we estimate $20,000 to $40,000. We are marketing to Ontario health teams and large enterprise level health systems. By our sales predictions, we'll hit $5 million in annual revenue in 3 years and scale from there. And we have the right partnerships and compliance to succeed. We are collaborating with the Community Health Coalition, one of the largest groups of specialists and primary care physicians in Ontario, as well as, for example, the KMH Cardiology Group. We're a new division of the Sigma Group, a technology company that has been in operation in Canada for over 30 years, with extensive dealings with the biggest companies in Canada, and is the largest provider of identity and theft protection services in the country. Our ask, we're looking to scale. We're looking for introductions to Ontario health teams, hospitals, physician groups, and all care providers, including pharmacy, physiotherapy, and home care. Our goal is to collaborate, to link all care providers and their patients in a virtuous circle of care. I'm a physician, and for the past 25 years, my role has been providing clear communication and establishing trust. I believe that business, when done well, has fundamentally the same objectives and is relational, not transactional. Sigmail is not a product, it's a journey, and fundamentally a journey of trust. I hope you will consider us for this journey, and I thank you so much for your time.
Excellent. Thank you, Dr. Rosario. Does anyone in the audience have any questions for Dr. Rosario or want to learn more about Sigma Health Tech? If so, make sure that you scan that QR code on your screen or head over to menti.com, enter the code on your screen, and we'll make sure to connect you directly with Dr. Rosario and for a follow-up conversation. Now, moving forward, we have reached the equity theme. While there's been longstanding challenges faced in Canada's healthcare systems, the pandemic really drew a spotlight to how vast Canada is and that many people struggle to access care. So we asked the Canadian innovation ecosystem, how might we design an equitable system that overcomes geographical and sociocultural challenges? The first presentation that we have this afternoon on to address these concerns is from Andrew Royce, CEO of Voice. Voice is helping to reduce barriers to help Canadians better understand and access the services that they need within their communities with professional interpreters who are often reached in less than 30 seconds through the touch of a button. Please keep an eye on the chat because we'll be posting a link to help you connect with Andrew and his team at Voice. Now, Andrew, over to you.
Good afternoon, everyone. Before I begin, I would just like to thank the Communitech team for organizing this event and giving all of us entrepreneurs the opportunity to present what we're doing and speak about how we're making a difference in the healthcare ecosystem here in Canada. Voice, we're an organization on a mission to remove language barriers in healthcare. The challenge in Canada is we are one of the most diverse countries on the planet. Canadians who speak a language other than English or French hit a record high in 2021. 1 in 4 had at least one mother tongue other than English or French. 1 in 8 spoke predominantly a language other than English or French at home. Relative to 30 years ago, this is double the rate of the number of non-English or non-French speakers. What does this look like in our healthcare system here in Canada? I think other speakers have spoken about some of the challenges for all patients to access care in this country. For patients who don't speak English or don't speak French, it's even more challenging. When we walk into a doctor's office, we walk into a clinic, we walk into the hospital, as patients, the first thing we do is we communicate. We say, "Hi, how are you? I'm looking to see a doctor. I'm not feeling well." Well, patients who don't speak the language have tremendous challenges communicating this, often relying on family members to communicate, waiting hours upon hours for interpreters. The situation is not an equitable one for patients in these situations. Refugees face so many barriers in their lives, whether it's war, whether it's losing family members, famine. It's tremendously difficult for them. Language in this country shouldn't be a barrier, and in particular in our healthcare ecosystem. The Voice application delivers a medical interpreter, often in less than 30 seconds or 20 seconds for the provider and the patient. Essentially, a doctor or physician would go on our app, request the language. Farsi, please.
I am finding your interpreter now. Thank you for holding.
And in seconds, I will have a medical interpreter on video able to translate the situation so the patient is able to understand, as well as the physician or the healthcare provider is able to communicate their services to the patient. You can actually request a male-only interpreter as well as a female-only interpreter for cultural or religious reasons.
Hi, this is Marcia. I will be your Farsi interpreter. ID number 10920011. Everything you say will be interpreted and will remain confidential. How may I help you?
سلام دکتر، گلوی من خیلی درد میکنه.
Hello, doctor. I've been having a severe sore throat.
Marcy, thank you so much. Have a great day.
My pleasure, and thank you for using our services. Have a great day as well.
Bye-bye. So that's a brief example of what we do at Voice. And we support over 6 million conversations a year in healthcare facilities all across Canada, as well as the United Kingdom and the United States. Where we are now in Canada, hospitals like Unity Health, Holland Bloorview, health centers like London Intercommunity Health Centre on the western end of Ontario, Trillium Health Partners, Life Labs, CHEO, Grand River, North York General, Mackenzie Health, St. Mary's. We are so grateful for these health systems for taking initiative to address inequities in healthcare, and at the height of the pandemic, bringing in Voice as a technology solution to make their patient experience so much better. In particular with St. Mary's, they ran a study and found 80% of patients were less anxious about their care because of Voice's services. They reduced the time to get an interpreter by 65%. Staff satisfaction with the solution was 92%. And for me, the most important data point that I received from that study from St. Mary's was there was a 50% increase in usage of Voice's services over the 3-month period, meaning there's a double the number of conversations we are having with our patients, which means they are getting better healthcare. Getting started with Voice, so we tailor our implementation, whether you're an Ontario Health Team, whether you're a hospital, whether you're a physician group. We set up the Voice app for you. It's an application off the App Store. We do provide free iPads and stands for you to utilize the services if needed. And we do integrate with a number of digital health platforms such as Health Hub, Epic, Teladoc, Zoom, a number of telemedicine solutions. What makes us unique? We support over 240 languages, including on-demand services for Indigenous languages such as Cree and Ojibwe. The interpreters are medically trained, so they understand both the medical language as well as the language of the spoken language of the patient, or sign language as well. The service is very affordable. It's respectful of all the privacy laws of our province and country. And as I mentioned earlier, integrations with telemedicine, patient monitoring solutions, as well as electronic health record. This is a personal journey, very important for me. I'm the grandchild of refugees. There are millions of refugees across the world, millions of immigrants. We can do better, and Voice is on a mission to really improve care for these patients and for these families. Thank you so much. Again, thank you to Communitech, thank you to all the presenters, and thank you to this great country of Canada, which gives us the opportunity to pursue our dreams and make a difference. Thank you so much.
Thank you, Andrew. If you'd like to learn more about Voice or have an immediate need for their technology, make sure you complete the contact form, which you can access by scanning the code on your screen, or of course, heading over to menti.com and entering the 8-digit code, and we will be happy to put you in touch. Now, looking ahead to our third theme, we're going to look at systems design. So while there are many challenges and areas for innovation related to the standard of care, we also need to consider the systems that underpin our healthcare systems. This was, no surprise, a very hot topic during our roundtables and the exploratory phase of this program. So arduous processes and fragmented systems complicate everything from staff schedules to tech procurement. So we asked founders, how might we design a cohesive, streamlined framework to better serve patients and retain healthcare workers? Our first presenter that we have today in this category is Wayne Lee, the founder and CEO of Next Up Care. So Next Up Care is automating healthcare one appointment at a time. As with previous presentations, keep an eye on the chat because we'll be sharing the link and the code to the Mentimeter so that you can connect directly with Wayne and the team at Next Up Care. Wayne, over to you.
Thanks, Daniela. So Next Up Care is focused on automating healthcare one appointment at a time. We've developed intelligent algorithms to be able to automate and optimize resource scheduling to improve operational efficiency and reduce wait times for booking medical imaging services such as MRI and CT scans. So the challenge is, if today you hurt your shoulder playing tennis and went to a doctor, she may recommend you get an MRI. Your referral would be sent to a hospital, and then you have to wait 5 or more days to be notified of your appointment. And if you're living in Ontario, frustrated to learn that you may have to wait 70 days or more for an exam versus a ministry target of 28 days. Today's scheduling is a manual, time-consuming, and costly process for providers. Doctors and patients are frustrated with waiting to confirm or change their appointments. Booking clerks are overwhelmed with a backlog of referrals, and hospitals are frustrated with not meeting their wait time targets and patient expectations. So our intelligent scheduling platform is a cloud-based, AI-enabled software solution that allows hospitals to algorithmically schedule patients without manual intervention, and then instantly confirm those appointments via SMS. The algorithms are the brains of our solution and where we differentiate ourselves. We consume data from a referral, patient preferences, hospital policies to recommend the optimal appointment. This is not like booking a doctor's appointment, which is about the next available slot. The algorithms are simultaneously maximizing daily utilization of the machine and minimizing wait times for the most number of patients. We perform 3 levels of optimization to ensure patients and their caregivers are given the earliest appointment. No queue jumping is allowed. The algorithms proactively attempt to reschedule patients who've been waiting too long, which is currently not available because it's too labor-intensive to follow up with thousands of patients that have already been booked and try to give them an earlier appointment. We do it automatically. And then finally, we close the loop by communicating with patients via SMS. And if a patient reschedules via SMS, the algorithms would automatically rebook them. No human intervention required. However, if you don't have a mobile phone or don't consent to using SMS, that's okay. We'll still book you and still notify you. The platform is intentionally modular, and a modular architecture ensures that we can work with providers to integrate with their IT applications via HL7 or FHIR standards. Our differentiator is the blue circle, our proprietary scheduling and optimization algorithms. To date, we've leveraged support from various provincial and federal sources and investors to develop the technology. We validated the solution with 3 hospitals and their imaging departments, collaborated with the University of Toronto Centre of Healthcare Engineering to validate our models. And this year, we started a collaboration with Sunnybrook as part of Obio's Early Adopter Health Network program and expect to go live next year. And we are looking for additional hospital partners. In a recently completed case study, we've completed a user and patient pilot with a medical imaging department and demonstrated a 54% reduction in operating costs within year 1 and time savings of over 3,000 hours a year by automating MRI scheduling. An imaging department with 4 to 6 booking clerks can expect an ROI of around $250K per year. In addition, we've received positive feedback from users and patients on the ease of use of the platform. Now, most scheduling solutions are part of the hospital information management system, and these systems enable users to manually query a calendar, find a vacant slot, and manually book patients. In contrast, we automatically book patients and manage their rescheduling in an automated manner. Now, why is all of this important? Well, the demand for imaging services is increasing 7% year on year due to an aging population and wider adoption of advanced imaging. There is pressure on providers to optimize their resources and do more with less. An algorithmic approach to scheduling is fast and fair and can be used to equitably prioritize and book patients and also help resolve the COVID backlog. Next Up Care, we can help you achieve that quadruple A, improve patient and caregiver experience, lower the operational cost of booking an appointment to less than $1, improve the provider experience and staff satisfaction, and ultimately improve access to care and lower wait times with better and smarter scheduling. Now, while the focus for us is on imaging, the longer-term vision is to be able to scale algorithmic scheduling for other use cases that require manual orchestration, coordinating physician care across health teams, automating patient transport, and staff scheduling. So in closing, I want you to imagine better healthcare with Next Up Care. Tomorrow, if you hurt your shoulder playing tennis and went to the doctor, your referral will be electronically sent to a provider. Our algorithms would find the most suitable appointment and send you a confirmation the same day. And before your exam, you would have the ability to reschedule at your convenience. And you won't have to wait 70 days or more for an exam because we're always going to try to clear the backlog and get you an earlier appointment. With Next Up Care, patients benefit, providers benefit, our entire health system benefits. And as for our ask, we're looking for additional hospital and strategic partners and look forward to connecting you within the chat. Thank you very much.
Wayne. Now for all of you, would you like to learn more about Next Up Care and how it can be implemented to improve the efficiencies at your organization? If so, please use the information shown on your screen and of course, placed in the chat as well. So our next presentation today is from Peter Feist, CEO of Staffy Canada. Staffy's proprietary technology brings together healthcare organizations and healthcare workers to improve patient care. They have disrupted the temporary staffing model with an innovative solution for healthcare workers, giving them more control over when, where, and how they work, all while earning higher wages than they would through traditional employment agencies and reducing HR costs for healthcare organizations. If you'd like to learn more about Staffy or connect with Peter, of course, use the Menti link that will be shared in the chat. So Peter, over to you.
Thanks, Danielle. I'm just going to get my screen ready here. Here we go. Perfect. Okay. Hi, everybody, and thanks for coming. I just wanted to thank everybody for participating in this and listening to our pitches. So my name is Peter Feist, and I'm the founder and CEO of Staffy. In the next 5 minutes, I'm going to tell you about Staffy and our unlikely journey from hospitality to healthcare, and how we're unlocking the full potential of the healthcare workforce. So no shifts goes unfilled, ensuring patients get the care that they need. But before I explain that journey, first, a disclaimer. Staffy is not an agency. We are a digital platform. Staffy is a place where organizations can post their open shifts and qualified workers can fill them. Unlike agencies, Staffy leverages technology, which makes our model more transparent and vastly more efficient. It all started back in 2015 with a simple question about the hospitality sector. And that question was, what happens if a waiter or a line cook calls in sick at a restaurant? In 2015, the answer to that question was there was very little that could be done when someone didn't show up for their shift. So we created Staffy, a platform where restaurants could post open shifts in real time and workers could accept them. Within a short period of time, Staffy had traction across 6 cities, had expanded to catering companies, event spaces, hotels, and worked with large corporations like Compass Group, Aramark, and Sodexo. And it was all working pretty well. We could have a worker on site in as little as 90 minutes. We were filling 97% of the shifts on our platform, and we were saving companies 20 to 30% versus traditional agencies, while paying workers 20 to 30% more. But then the pandemic hit, of course, and decimated the hospitality industry. Workers who had been using Staffy for incremental income were suddenly searching for any opportunity to make up for their lost jobs or reduce hours. But there was no shifts in hospitality anywhere to be found. So we started reaching out to everyone and anyone to see if they needed help. And of course, we found them. In the early days of COVID-19, hospitals, retirement, and long-term care facilities needed help for cleaning, culinary, and clerical roles. So Staffy was a perfect fit, providing an easy and transparent way to fill those open roles for non-healthcare related shifts while providing work to desperate hospitality workers. And then within a few weeks, one of our healthcare facilities said to us, "This is working so well, you wouldn't happen to have nurses or PSWs as well, would you?" So that was a good question. And we thought, why not? Staffing shortages exist in healthcare just like in hospitality. Open shifts can happen due to illness, vacations, or an augmentation need. And if open shifts are not filled, customer or patient experience suffers. Workers in healthcare might be willing to pick up extra shifts if they're easy to find. So we got to work. Because while the challenge is similar, the environments are not. Healthcare is far more complex and much more heavily regulated. And we need to retool the Staffy platform for healthcare. So we went from SmartServe and food handlers to immunization records, CPR, N95, and built a robust 15-step journey to ensure the healthcare workers were vetted extensively. We then built Staffy out to accommodate the wide range of healthcare roles, from PCAs to RNs and everything in between. And we are able to do that with support from within the sector. Just like that healthcare administrator saw the value in Staffy and wanted us to see expanded in healthcare, we were particularly fortunate that Dr. Bob Bell, a former Deputy Minister of Health, and Sharon Lee Smith, a former Assistant Deputy Minister of Health, felt the same way, both seeing the potential for Staffy in healthcare and providing critical guidance on our path. And now, some 2.5 years later, Staffy is working with organizations and health and workers across healthcare. For workers, they are able to pick up shifts that suit their schedule and allow them to be completely autonomous. In a recent Polaris survey, 90% of respondents said that they like Staffy because it allows them flexibility to schedule shifts around other responsibilities, such as family commitments, education, and other employment. For organizations, they have access to a marketplace of highly vetted, qualified workers for unplanned or planned shifts across a wide spectrum of roles. Organizations decide how much they want to pay to the worker on an hourly basis, and Staffy charges a modest admin fee, saving 23% on average versus traditional agencies. And the results speak for themselves. In 2 years, 15,000 qualified workers have come onto the platform, including more than 5,000 nurses. We filled more than 100,000 healthcare shifts representing approximately 1 million hours, and we've been able to fill 72% of the requested shifts. So it's not surprised that some of Ontario's top hospitals and long-term care facilities are working with us, and we're incredibly grateful and appreciative. And to highlight one such partnership, I'll quickly touch on University Health Network for a minute. In October 2020, they reached out to us because they had a staffing challenge and an outbreak in LTC. 2 months later, in 2020, they leveraged Staffy to set up the first COVID vaccine clinic in the country. We were able to help secure 50 staff within 32 hours, and Staffy nurses delivered many of the first vaccines in all of Canada. And today, the UHN continues to work with Staffy to leave no shift unfilled in their ICUs, ERs, and everywhere else within their hospitals. And we are in the process of launching new roles, including medical imaging techs, to help address the backlog of surgeries created by the pandemic. And while the pandemic is mostly over, the systemic staffing shortages are not. There are significant staffing issues across healthcare, especially within our aging population, and of course within hospitals, as we are all aware. So the need for innovation solutions like Staffy will continue. We're continuing to build and expand on the Staffy platform. We are expanding from our existing model to providing more innovative solutions like digital credential management, where you can manage the status of your certifications of your internal workforce, and internally scheduling, where you can optimize your internal scheduling, and when shifts are unfilled, we can fill them automatically through the platform when your internal resources aren't available. Our ask today is to help us build awareness of the Staffy brand and the platform, and how we're helping to unlock the full potential of the healthcare workforce. We need your assistance to help build our network of hospitals and facilities with open shifts that need a way to fill them. The more clients we have, the more workers we have, and the more workers we have, the more shifts we can fill, which will help us realize our mission of leaving no shift unfilled. Thank you for your valuable time today, and please reach out if you have any comments or questions.
Thank you, Peter. So does anyone have any questions for Peter, or would you like to learn more about Staffy? You have the opportunity to connect directly with their team, so that make sure that you complete the Mentimeter information that's on your screen now, and we will be very happy to put you in touch with the Staffy team in the next couple of days. So our next presentation today is from Walid Mouaswas, CEO of PharmaGuide. PharmaGuide operates as a health technology company specializing in pharmacy-related services and products. The company focuses on cloud-based applications designed by pharmacists to optimize workflows, patient outcomes, and regulatory compliance. Keep an eye on the chat, of course, for our Mentimeter code so that you can learn more about PharmaGuide and connect with Walid and his team. Now, Walid, over to you. Unmute. There you go.
Thank you. Hi, my name is Walid Mouaswas, and I am a pharmacist, pharmacy owner, and the CEO and co-founder of PharmaGuide. You know when you walk into a pharmacy and you have your prescription in your hand and you're not feeling well? So you walk up to the counter and you hand it to the pharmacist, and it looks like it's only one medication, but you end up having to wait 45 minutes to get it? You're walking back and forth across the counter, you're huffing and puffing. Well, your pharmacist feels that too. They can feel the agitation and frustration, and they're going as fast as they can, but while dealing with 400 prescriptions, phone calls, making sure there's no interactions, and then documenting it all, there's an entire process going on behind the counter that patients do not see. As pharmacists ourselves, we realize that in a multi-billion-dollar industry, even minor adjustments can have major impacts. Just by automating some aspects of documentation, we can save pharmacists significant amounts of time. And how much safer could they do things if that time was spent to improve patient outcomes? Here at PharmaGuide, we've built integrated pharmacy solutions that help save time, generate additional profits, and improve patient outcomes and safety. As times are changing, pharmacy operators have realized a greater need for integrated systems and digital strategies to serve their patients. Unfortunately, healthcare platforms are primarily managed on legacy systems that have not been designed for the new digital age. As we look to solve this problem, we realized that pharmacies had a wealth of data available to them that was not being used but to its full potential. And therefore, it resulted in billions of dollars being wasted. Pharmacists are medical experts that are regularly available and are considered among the most trusted healthcare professionals. Governing bodies have been expanding their role to support patients in their communities, but with a lack of tools, our pharmacists are often stuck feeling like pill counters. And that's why Foxcloud was created by pharmacists for pharmacists to overcome these challenges. We knew that it would be very difficult to replace existing systems, so we built Fox as a software add-on with state-of-the-art integration capabilities. Fox is a multi-tiered system that offers pharmacists modules that empower them to accomplish day-to-day tasks in a fraction of the time using workflow automation. For example, Fox Dash was designed to unleash the wealth of pharmacy data available. And our analytics platform not only provides live data, but it also brings that data to life to enable stakeholders to improve patient care, better manage their inventory, maximize their profits, and it utilizes our own logic engines and machine learning algorithms. In our third year of operation, PharmaGuide is growing faster than ever. We've been able to accomplish this through collaboration and partnerships. We have already established valuable relationships with entities such as the National Research Council of Canada, Google, IRAP, and pharmaceutical manufacturers such as Sanofi, AstraZeneca, Antaro. Our number of active users has been continuously growing since the beta launch of Fox in 2020, with projections to surpass over 1,000 users by Q1 23. Pharmacy users in particular love Fox because the return of investment is so apparent. When just looking at actual profits generated from additional services provided using Fox, the typical pharmacy sees a 1,700% return on investment. But we didn't stop there. When we designed Fox, we set out to create the ultimate proposal to all owners. We knew that the answer was to create a product that not only increases revenue through pharmaceutical services, but it also protects that revenue by ensuring that pharmacies are in full compliance with systems such as our live auditing and price verification systems. And lastly, we wanted to keep more revenue in the pharmacy by optimizing the base costs, which we did through our AI-powered smart ordering system. We are extremely passionate about healthcare and improving the patient journey. And as we expand our offerings and grow PharmaGuide, we are adding integrations into EMRs, more pharmacy systems, and integrating into patient systems as well. We're also expanding our utilization in AI and machine learning. And our mission is to actually make a sizable difference in the quality of care provided today, so that when you are at that pharmacy and you're not feeling that well, you're only waiting for 5 minutes and not 45. Thank you very much for listening.
Okay, thank you very much, Waleed. If you're interested in learning more about PharmaGuide's brilliant solutions, pop your information into the Mentimeter on your screen now, and we'll be sure to put you in touch. Okay, so we've already heard 6 incredible pitches, but we're not done yet. Still to come are pitch presentations about using AI to manage disease through nutrition, a virtual digital health marketplace, a platform that coordinates therapy with partners throughout the healthcare sector, and a cloud-based practice management and cumulative medical record storage system. Following the pitches, you'll have the opportunity to network with peers, partners, customers, and potential investors during our networking sessions. But before all that, we're going to have a quick 5-minute break. So we'll see you back here in 5 minutes. Okay, welcome back, everyone. We're jumping right back into the 4th theme we're looking at today, which is prevention. So Canada's healthcare systems are in crisis. So we asked, how might we restructure them to focus on prevention and early intervention and reduce the need for acute care? We have our founders here today to share brilliant solutions to move the needle and support the improvement of healthcare. Our first presenter in the prevention category is Dr. Jeff Alfonsi of RX Food. RX Food is a digital health company that uses AI-powered technology to prevent and manage chronic disease through nutrition. RX Food is primarily used by healthcare providers or researchers to revolutionize the collection, analysis, and trending of diet quality measurements. As a reminder, we'll be posting the details to connect with Dr. Alfonsi in the chat. But until then, Dr. Alfonsi, over to you.
Thanks, Danielle. And thank you everyone for coming. Really excited to be here. Super excited to talk about what RX Foods is doing and how we're trying to revolutionize the way that we measure and use nutrition and diet. Really trying to make this more like an ECG or a diagnostic test that can fit into practice. And so, unhealthy diet is a leading risk factor for death, disability in Canada and the world. I think sadly, these are increasing, resulting in higher rates of metabolic diseases like obesity and diabetes. But we're also starting to see that these metabolic diseases also increase the rates of other things like depression and mental health. But I think everyone here knows that nutrition is important. That's never been the problem. The problem is, how do we measure this and make sense of it in a way that actually is effective? And currently, ways that we look at diet, it's time intensive. Patients never want to fill this out when I ask them to do it. And really that results in just inaccurate, incomplete data and a huge missed opportunity. But nutrition does actually have the potential to be engaging, to be fun, to positively impact our health and wellness if it could be done in a way that's easy, accurate, and evidence-based. Now, there's also many products that exist out there to try to get at understanding how someone's eating, but they've all struggled with adoption, particularly in the healthcare setting. And I think that's because they miss out on a key factor. There are two different but equally important users in this. We have the clinicians and the patients, and they're seeking different experiences. From a clinician perspective, gathering a food history is very onerous. So I want to be faster ways so I can save large amounts of my time, appointment time, visit time. I want to be confident in the data that comes back. I want to highlight certain things, maybe nutritional deficiencies that I might be missing. And I want to make it accessible to people and actually fun for people. Whereas from a patient's perspective, they want something that's easy, that's fast, that's engaging, and actually simplifies the way that food is, because it could be highly complex and stress-provoking, especially when someone's trying to make a change for a particular medical condition. And all of this hinges on the way that we get the data in or the login. And I think if anyone has used stuff like MyFitnessPal, typing in orange juice, finding 10 options, picking the one, getting the size, it's a poor experience that has extremely low completion rates. It also is very hard to capture the range of ethnic foods that we have in this country. And ultimately, this results in bad data in or garbage in and garbage out. And so that we can't actually create anything that helps someone with personal recommendations. And so that's what RX Food is about. We want it to be the future of nutrition by bringing together the best minds from medicine. So we've got a number of physicians, researchers, nutritional science, dietitians with technology, engineers, data scientists, AI, to come together to find ways from these two perspectives to look at it in an entirely unique perspective. And so since starting RX Food 5 years ago, we've had the opportunity to work with amazing partners in Canada and the United States in multiple settings, from primary care to advanced heart failure or diabetes. And we have access to over 5 million patients through these partners that we're working with. So I'm going to tell you very briefly the solution that we have as well. So, again, I'm going to use an analogy of an ECG. So we have a clinician portal, right? This is a secure portal. You have very intelligent analytics, ways to review data quickly, to save time, to communicate asynchronously with patients. This would be like the ECG machine. We also have a patient portal, and this is ultimately most of the time a smartphone app that the user takes. We do have ways around that to support equity and access, but the idea is we tell patients they only have to take pictures of their food for short periods of time, often just 3 days. The AI, just through the photo, figures out what's in it, the approximate size, and then maps back that into diet quality data. So this would be kind of like the leads that connect the ECG to the patient. And finally, we have the printout of the reports, and these are customizable, and they show advanced analytics that have previously not been available in clinical practice. And they help break food down into entirely new ways that's much more practical and understandable. And so the impact, we do look at the impact all the time in everything we do. From clinicians, the data says they can get a dietary history 75% faster. It also supports virtual models of care, and they're able to hone in on key aspects of what matters faster, so they can spend more time talking through actual interventions and change. From a patient perspective, 94% that completed a 3-day food log said they made a dietary change, and they actually want to continue to repeat these maybe every 3 or 6 months, like other sorts of tests, so they can get ongoing feedback in terms of how their diet quality is changing. We've also always been looking at ways to get deeper and deeper data. We were born out of a clinical setting, and we continue to look for that. So we're always measuring our impact. For diabetes, we've been able to improve diabetes for people that were already on medication. So in addition to that, just by looking at ways to improve their diet, on par with what an addition of another medication would have done. And this in turn has big cost savings. For those living with obesity, we're able to support significant weight loss without medications. And in the preventative care setting, we were able to drive very meaningful improvement in diet quality metrics that can have significant downstream prevention effect on everything from cancer to diabetes. The other key point I wanted to talk about what makes RX Food different again is that there's so much out there that has tried to look at solving parts of this, but no one's looked at it holistically, where you can have secure data, easy to enter data, evidence-based publications, broad scale adoption by clinical practice, and it works for a range of ethnic foods. And also in a recent deployment, we do look at, can we meet the quintuple aims? And we were able to show that we could improve health. We were able to have, again, better A1C, improved weight. In addition, we were able to show that we can save costs to the system, both from these chronic diseases as well as time savings for the actual clinician's time, so they can see more people faster. We also have improved patient and clinician experience. And from a health equity perspective, we were able to identify aspects of food insecurity and create ways to manage those more efficiently. So very excited for the opportunity to work with all sorts of partners on this call. Some of the ways that we work together, we can provide just the technology to existing clinical teams like Vanity Health teams. This may help in multiple ways, like increasing access to care. You could have a stepped model where everyone in the practice can have it, and those that need more support can see a dietitian. It can drive efficiencies, and it can support measurement-based care where you can actually see how diet quality is changing over time. We also have our own clinical team of physicians and nurses that can fill in gaps for areas that don't have access to this. And we can also partner direct to consumer or other ways where we can focus on food banks, schools, industries to promote education, better products to buy, and other ways to work together. We're very excited for the opportunity to co-design the future of nutrition with you. And so again, just to summarize, RX Food is the ECG for nutrition. It's making it easy, accurate, and evidence-based. Thank you.
Okay, excellent, Dr. Alfonsi. Thank you. Do you have any questions or want to learn more about implementing RX Food? If so, while it's fresh in your mind, make sure to pop your email into the Mentimeter and we will connect you directly with their team for a follow-up conversation. Next up, we have Dr. William Cherniak, the founder and CEO of Rocket Doctor. Rocket Doctor is a rapidly growing digital health marketplace that provides comprehensive patient care virtually by connecting patients with fully licensed physicians of all disciplines through their proprietary tech platform. Founded in Toronto, their service has cared for over 220,000 patients, expanding beyond Ontario to service Alberta, BC, and most recently, California. Watch the chat for details on how to connect with Dr. Cherniak and the Rocket Doctor team. Now, Dr. Cherniak, over to you.
Great. Thanks so much, everybody, for coming today. And I'm just trying to share my screen. So let me get this up. So thanks for the intro. So my name is Dr. William Cherniak, and I'm the founder and CEO of Rocket Doctor. So I'm going to talk to you today about our company, which is, as you heard, an integrated care digital health platform and marketplace that pairs advanced medical devices with virtual care in order to expand the capacity of what we can do digitally. And so I'm going to take us back in time a little bit and start off with my background, which is in emergency medicine, as well as family practice and global public health. I've gone to school and taught at a bunch of different centers across Canada and the US, University of Calgary, Toronto, Johns Hopkins, and University of Southern California. But I'm going to go back 10 years and actually take us to East Africa. And that picture on the right side of the screen is from rural Uganda. And I start there because my first startup was actually in the nonprofit sector with a group called Bridge to Health Medical and Dental. And in this picture, I'm holding an advanced ultrasound device. And what we came across trying to bring healthcare to underserved communities that might lack running water, electricity, was actually high-tech diagnostics were a solution to care. And so what we're doing here is we built a program to utilize a cloud-based teleradiology platform to remotely mentor and train physicians in rural Uganda how to diagnose pneumonia in children with a team of 50 physicians across the US and Canada. So that caught the attention of the New York Times, which got us a cover story in the spring of 2019 and really kind of pushed me personally more into the technology sector. In the fall of that year, not dissimilar from this fall, it was a very busy flu season. Lots of patients with cough, cold, fever, flu symptoms coming to the hospital who I felt as a full-time emergency physician didn't really need to be there. And so started to think about, could we pair virtual care, advanced medical devices, and really prevent unnecessary ER visits? And as we started to put the company together, of course, the pandemic hit and rapidly expanded access to services, and now have seen roughly 250,000 patients across Canada, as well as the state of California and Pacific Northwest, with more than 400 physicians who have signed on. And so at a high level, the important thing to think about here is what we're building at Rocket Doctor is the most technologically sophisticated digital health platform and marketplace. We're not trying to just recreate the in-person experience by doing this, where you're on a FaceTime, or a phone call session with a physician, but how do we actually use technology to make healthcare better? And so to that end, I thought I'd go through a few key factors of why we are different. And so taking a step back at a fundamental level, myself being a practicing physician as the founder and CEO, we really focused on doing is building a true community of doctors. So by doctors, for doctors. And we heard that with a different company from the pharmacy lens. And it's important as a practicing clinician that we facilitate these MD connections. We allow docs to talk to each other and produce happier physicians, which ultimately makes better quality care. This is a picture of a meetup from Vancouver with some of our docs, and it was obviously quite a bit warmer back then in the summertime. And what powers the whole system here is our software that we've built. And as a practicing doc, I've seen thousands of patients myself on the system. The key thing that really gets us is administrative work and too many clicks. And so our system was not built for billing codes, but it was built to automate and optimize virtual care. And so if you're running a busy practice with 20 to 30 patients in a day, what folks may not understand is 2 minutes per patient adds up to a full hour of paperwork at the end of your day. And docs love this and generally does optimize care, which provides better services to patients. A key complaint of virtual care also is that, well, what's the point? Because the doc's just going to send me to an in-person visit. So what we've shown at Rocket Doctor through our analysis is that actually 94% of patients can be managed virtually without an in-person visit. And the way we've done that is by building proprietary triage and screening protocols that actually make sure patients coming into the platform are appropriate for virtual care, and then making sure that the doctors we connect them to actually are the best suited for those patients by asking physicians how they want to practice medicine. And we've recently released a patient portal and smart matching tools that are coming out to optimize this and automate those processes. Again, we're a platform, we're not a provider. And what's really neat is that's allowed dozens of different specialty clinics to start operating on our service. And what we've done is then taken those and put them together on our cloud-based EMR, such that every subsequent physician who you see has the records of every previous doctor that's a part of that patient's care team. And we allow really integrated high-quality care, in particular with family physicians who are able to actually follow patients on a longitudinal basis. And we know tens of thousands of patients use family doctors entirely virtually as their family physician. Unfortunately, changes to reimbursement in Ontario took that away from many patients, but hopefully we'll be able to advocate to fix that. I'd be remiss if I didn't mention that we're also in the United States. And so I always joke with my American friends, it took a Canadian to see the problem with Medicaid, which is for folks that are at or below the poverty line, pregnant women and children, and following a similar model of integrated care there. And then with devices, these are live across Canada. We have half a dozen virtual stations with Bluetooth stethoscope, digital otoscope, and really powering care in that way. This is a case study of something I'm very proud of, where we worked with Georgian Bay General Hospital this summer as they were facing a staffing crisis. We used our model to create a virtual emergency department free of charge for the hospital. And the CEO has written that we've prevented 9 patients per day in one hospital, one partner, in one part of Ontario, unnecessary ER visits. And so, this scales up across the entire platform when we use these kinds of processes. 700% growth in Canada, following a similar trend in the United States. And it's not just me. One of my co-founders there is one of my brothers. He went to Ivey, London School of Economics, was an M&A lawyer at Torys. and as our COO. Doris worked for Kaiser in their Medicaid branch. David went to UC Santa Barbara for coding, and just a great team generally. And, we've got a deep bench of clinical expertise. All these docs work with us and help provide insight, guidance in order to make sure we have the best possible system. And so as folks are thinking about, how do I engage with Rocket Doctor, we have 3 key avenues, and many other companies have said something similar about looking to engage with additional hospitals, OHTs, and otherwise. And so in the public sector, we're here to help. And, we just announced a partnership with the Canadian Mental Health Association today with our substance use program. And we partner with private industry, and these in brackets are some of the companies we've worked with, and as well tech companies. So we're never going to be the best at everything in the world. There's a million different, great things in tech. And so what we're looking to do is build, again, the most digitally enhanced, sophisticated digital health marketplace. So if you're a tech company that wants to work with us, let me know as well. Thanks.
Okay, thank you, Dr. Cherniak, for everything that you and your team are doing. So do you have any questions for Dr. Cherniak and want to connect with Rocket Doctor? If so, make sure that you follow the instructions that are on your screen now, and we will provide you with an introduction to their team so that you may learn more. Of course, also those details are in the chat if you missed them here. Following that presentation, we have Saretta Herman, co-founder and clinical director at LeilaCare. So LeilaCare is a human-first, tech-powered mental health care service that guides patients to therapists for individual, couples, or group therapy in a timely and personalized way. Saretta Herman is the co-founder and clinical director, while she's also a social worker with over a decade of clinical experience in community and private practice settings. As with the other presentations, I encourage you to watch the chat for details on how to connect directly with Saretta and the team at LeilaCare. Saretta, over to you.
Okay, thank you, Stacy. I'm just gonna pull up, sorry. My presentation, okay. All right. Hello, everybody. Thank you for being here. So as Stacy mentioned, Leila is a mental health care company. As many of you are probably aware, the mental health care sector has several challenges. So there's a lot of fragmentation and yet not a lot of personalization. There's also a lot of variability in terms of clinical quality, dependability of services, wait times, et cetera, and different services in the sector. So in this space, our mission is to empower people to take control of their mental health. So on an individual level, when people are reaching out for care, it's usually because they're feeling overwhelmed. So they're unable to cope on their own anymore with the symptoms they're experiencing. So they're highly motivated to get connected quickly, but most people are not mental health experts, and so they don't know exactly how to get connected. So a lot of people end up online, and they may find services like free, self-led, or short-term services that aren't a great fit for their level of symptomology, or they may end up at marketplaces or listing sites that don't have a lot of guidance on how to connect to the right mental health care practitioner, which in mental health is super important to have positive clinical outcomes. So by the time people get to Leila, we often hear the feedback that this was their last attempt before they were going to fully give up on even connecting to care because they were so frustrated with the process or they've had so many negative experiences. So we try to provide a really different kind of experience for people. We connect people to care in a warm and dependable way. In our work, we focus on 3 core ingredients that help people get better. So the first is warmth and human validation. So when connecting with us, we want people to feel heard and supported. So we listen to people, correct any misunderstandings they might have, explain our processes, and offer options. And all of this builds trust in our service and our providers and hope for a better future, which research shows that in mental health is really important for positive clinical outcomes. All of this is followed by connecting people to the intervention that's most appropriate or clinically indicated for their situation. So in doing all of this, we're biased towards two things: personalization, which I'll talk about in the next slide on matching, and improving care collaboration, meaning connecting with other people involved in people's care in order to improve the quality of their care. So currently we're focusing on primary care doctors, insurance providers, and hospital partners. So for matching, of course, we start with clinical fit. So looking at people's presenting issues, their complexity, their intensity, and matching them with providers or programs that are going to be a good clinical fit for them. We also, of course, look at logistical fit. And then finally, we consider interpersonal fit, which means if a client would like to be matched to a therapist who specializes in their own personal background or a specific lived experience they've had, we provide options for them based on these factors as well. So since launching in 2019, we've had a lot of success in the community. We've been able to offer over 50,000 therapy appointments. We have almost 200 partner therapists on our roster. We've consistently had really amazing client feedback, and 90% of our clients return after their first session. We are currently in 3 provinces and planning to expand to more in 2023. So what we're focusing on now and how we might be able to partner with various people, as I just mentioned, geographical expansion. So we're trying to be in more Canadian regions in order to improve access to care. We are focusing on collaboration with primary care doctors in the broader health system. Also on expanding our specialized services and programs that address high needs areas as well as underserved areas, such as disability care or DBT programming. And then also while we're doing all of this, continuing to build out our in-house platform in order to improve quality and experience, both for our clients and our therapists. So thank you so much for your time. Our founder and CEO and myself will both be at tables after the pitches if anyone has any questions for us. All right, Stacey, back over to you. Oh, sorry, Danielle.
It's all good, Saretta. Thank you very much for your presentation. And I hope there'll be many people here who want to learn more about the opportunity to work with Layla Care. So if you have any questions or you want to connect to learn how you can collaborate, make sure that you follow the instructions on your screen so that you have the opportunity to learn more. Now, moving ahead, last but not least, our final presentation of the day is from Heidi Watson, the founder and CEO of Guardian EMR. Guardian EMR is a cloud-based practice management and cumulative medical record storage system. The system has a unique approach to health record security that allows their team to have multiple businesses and healthcare professionals in the same system at the same time, meaning that they can collaborate from across healthcare communities, thus improving communication across healthcare teams and improving opportunities for early detection and prevention. So Heidi has much more to share for all of you. So Heidi, over to you.
Thanks, Danielle. Hello, everyone. I'm Heidi, the CEO of the Canadian Electronic Health Information System. We are the creators of Guardian EMR. After working in public and private healthcare for over a decade, I saw how fragmented and prone to errors the communication channels in healthcare are. Circles of care are being interrupted by technology-created data silos. These data silos are occasionally created intentionally to improve internal system security. We're even seeing trends in the market now where EMRs are being created for specific professions, which is great for functionality, but it only makes the communication silos worse. So unless we approach the problem differently, these interoperability issues that are seen across healthcare teams in community care, outpatient care, and acute care settings is going to continue. In terms of simplicity and efficiency, many EMRs are also overly complex, and they lean towards serving physicians rather than the whole health team. Or they have specific workflows that force clinicians to change how they practice to meet the logic of the software. In response to these problems, we have been developing the Guardian software suite. Each of these parts integrate with our core offering, Guardian EMR, and I would like to highlight today our data health exchange, so the Guardian Bridge. This allows our EMR to use its advanced security core as a connector between other health softwares, research institutes, and patients. It allows us to connect the entire health ecosystem together. Guardian's unique differentiator is how we handle that internal security. The system is able to mimic the circle of care seen in healthcare. While a client can have a single centralized chart, many organizations, care teams, and even solo professionals from different organizations can coexist inside that chart, collaborating as much or as little as they need to. The system does have powerful automation throughout, and it can reduce paperwork and administrative burden by over 50%. We have things like automated reporting and even automated charting. So we've done this without adding any additional workflows to the system, maintaining that flexibility so that any kind of health professional can use Guardian EMR. And to assist with population health and prevention, we're able to involve the patient and we're able to involve researchers into that record-keeping process. So we use consent-based data sharing that allow for population health monitoring to happen. We have all the other expected features that you would usually see in an EMR. We also have stackable user roles. This is key to how we maintain that internal record privacy. So each user's view is tailored to their specific needs for their practice or if they're a patient storing records. And we've made it so that onboarding is very, very simple. Our modern system is deployed on health-specific servers to ensure legislation compliance with PIPEDA, as well as policies like SOC 2 and ISO. We have the typical break the glass and our one-way chart share to have the dynamic between records. Overall, Guardian is a lightweight EMR that's easy for your staff to onboard to. We brought in health professionals and asked them to complete a task in the system with no orientation. Everyone was able to intuitively complete their tasks quickly or as fast as with the EMRs that they're familiar with. We are currently operating in Canada with over 100,000 records on the system. We've worked with most types of health professionals, and the system is actually the most popular with psychologists. Guardian EMR is integrated with OnCall Health and Zoom, and we are also internationally deployed in Côte d'Ivoire and have partnerships in Rwanda, South Africa, and Zimbabwe, where we've integrated with other EMR providers on those sites. Our team did an analysis of cost for a feature match competitor. We used a 200-bed care home as an example. And you can see here that we loaded all of the staff in the facility on, not just the medical core. A lot of EMRs do this to save cost. And still, after loading everyone on, it still resulted in a lower implementation cost of over $100,000 and then $50,000 in year-over-year savings from there on. Our team in Canada has 12 people, and combined, we have over 60 years of combined experience in healthcare. And our advisory board has experience with international health networks, as well as experience with implementing enterprise pilots and projects. I'd be very happy to chat more at the Guardian table if you have any interest or questions about pilots or integrations. Thank you so much for listening.
For presenting Heidi. If you have questions for Heidi or want to learn about how you can improve care and efficiencies using Guardian EMR, make sure that you follow the instructions on the screen, scan the QR code, or go to menti.com and enter the code that we have there. Or as Heidi also mentioned, you can find her at the Guardian table in the networking portion of the event. So that almost brings us to the end of the presentation portion of the day before we move ahead to the networking. So here are some next steps that you might want to consider. If you would like to learn more about any of the companies that pitched today, but you missed their Menti links, please feel free to contact our team at futureofhealth@communitech.ca, and we will be very happy to put you in touch. And then looking ahead, if you are looking to supercharge your business innovation, make sure you leverage Communitech's unparalleled reach across the country to source founded in Canada innovation to address business challenges and opportunities. So you can contact my colleague, Adam Stryker, for more information and learn about this incredible opportunity. And of course, we want your feedback. So before we get to the networking portion of the event, we would love to know what you thought of today's session. So in the chat, there will be a link to our event survey. This information is really important to us because it helps us to continually improve our programming and our efforts to help founders and healthcare organizations to innovate. So make sure you complete that either in the chat or in our follow-up email that you'll receive. So now we'll be moving on to the fun part. You'll see what looks like a loungy conference space on your screen once we break for networking. There are tables labeled the names of each of the companies that you saw present today around the perimeter of the room. And you can navigate between floors 1, 2, and 3 using the toolbar on the left-hand side of your screen. To join a room, quickly select a seat at the table you wish to join. And also note that we will be extending our networking portion of the event until 1:45 for any of those who are available and wish to continue chatting past our original time, which was at 1:30 p.m. Eastern Time. So thank you again to all of our presenters, our founders and partners, and of course you, our wonderful audience, for giving us your precious time today. For now, that is it from me, and I thank you all for being here, and I hope that you enjoy your time networking.